friends, I am Rishmi. Welcome to SRS Info. Health education and community pharmacy is a very important subject under the syllabus of first year D.Pharma. Today we are going to start this subject. First, let us understand what is health education and what is community pharmacy. Before going to the detailed study, we have to understand the meaning and aims of this health education and community pharmacy. What is health education? Health education can be defined as the process which affects the changes in health practices of people and also the knowledge and attitudes related to such changes. Health education is a process by which the health practices of people can be changed in a positive way which promotes the community health. And it also improves the knowledge and attitudes of people related to such changes. Okay, and the term health education was coined in the year 1919. And what is the need or what are the aims of health education? The main aims of this health education are first to ensure the value of health. Yes, we must give proper value to health, the personal health and community health. And we have to consider health as an asset of the community. Healthy community can provide the benefit of the society. So, healthy individuals can contribute to the society and healthy society can contribute to the country. So, we have to consider health as an asset. Then to part knowledge, attitudes and skills in people to maintain and develop health practices. Then to promote the development and use of health services. These are the main aims why we need health education. Now, what is community pharmacy? Community pharmacy is a healthcare service. It's a service. If we are educated, then we can give service to the society. So a community pharmacy plays a very important role to provide healthcare to the society. And this community pharmacy motivates the society by the following points. First, it helps to decrease mortality and morbidity. If we are educated about health, how to maintain the health, then we can provide the society the tips of the healthcare practices so that it helps to decrease the mortality and morbidity. What is mortality? Mortality is the death rate. What is morbidity? Morbidity is the condition of suffering from a disease. If we are suffering from a disease, the condition is called as morbidity. So, community pharmacy through the healthcare services can decrease the mortality and morbidity rate. And it can decrease the growth of population. Of course, when we are aware about the negative effects of increase in population, we can accept the practices of family planning, birth control, etc., by which we can decrease the growth of population so that we can give good healthcare services to the public. The improvement in nutritional status. Community pharmacy can provide education about the importance of nutritional status, and community pharmacy can play a very important role for making aware the public about the importance of nutritional status, and they can give proper service to make available this nutritional healthcare practices of the society. Provision of basic sanitation. This is the key of healthy living. Sanitation is the key of healthy living. The sanitation is the basic requirement to lead a healthy life. If there is no sanitation, there is a possibility of become diseased. So we cannot give proper input for the development of our society. Community pharmacy can play a very important role in providing and maintaining sanitation in society. Provision of healthcare system. Community pharmacy gives the provision for maintaining the healthcare system. And then reduction in the levels of poverty. This is not property, poverty. Please correct it. Reduction in the levels of poverty. The society is getting aware and getting knowledge about the importance of the reduction in growth of population and how we can maintain the nutritional status, the basic sanitation requirement, and the provision of the healthcare system in our society, and they can decrease the mortality and morbidity rate then very gradually we can get rid of poverty. This is one of the most important role of community pharmacy. This is very significant also. Now, before going to the detailed study about this health education and community pharmacy, we have to understand the meaning and definition of some important terms which are related to this health education. Okay, so in this class, I will introduce these new terms related to this healthcare education system. So, what is the first one? This is incidence. Related to the disease situation, incidence means the number of new diseased cases. The cases occur in the community. Okay, let us take an example, COVID-19. We are all going through this COVID-19 pandemic time now. Okay, so let us take this most important example. You can understand all these terms with this COVID-19. So, the number of new patients identified or number of new cases occur in the community, we can call as incidence. Then next is isolation. What is isolation? We are all familiar with this term now. Okay, the patients who are infected by this COVID-19 virus, they are advised to live isolated. Why? Because isolation means the complete separation of a patient from the community to prevent the spread of a disease. So we have to prevent the spread of that disease, so that the complete separation of that patient from that community is very essential. This term is isolation. Okay. Then what is contact? Any person in contact with a patient. That is contact. Contact means if a patient is in contact with another person, then that person we consider as he is in contact with this patient. Contamination. The presence of infectious agent in or on the surface, water, etc. This is called contamination. The presence of infectious agent, that is microorganism. The microorganism which causes infection is called as infectious agent. So, if there is the presence of infectious agent anywhere, it may be on the surface or in water or in food items or any other utensils of the patient, whatever it is, if there is a presence of the infectious agent, we can call it as that item is contaminated, that water is contaminated. Host. Host means animal which allows the growth of a disease agent. We can call it as host. This is a person, the microorganism enters into his body and this microorganism grows within this body. That means this body provides an environment to grow this microorganism. So this body we can call it as host. Okay. Infectious agent. The microorganism which is capable of producing an infection is called as infectious agent. The microorganism grows within this body and it is capable to give a disease to this healthy person. In that condition, this microorganism is called as infectious agent. Okay. Infection. What is infection? The entry and development of an infectious agent in the body. The process is called as infection. See, this is the human body. The infectious agent enters into this body and it starts working, it starts growing. Then what happens? It gives infection to this patient. And the disease caused by this infection is called as infectious disease. Disease resulting from infection. Okay. Then what is infestation? Infestation is the presence of a parasite either on the surface or in the tissue of the body. This is what we call as infestation. The presence of a parasite or any other microorganism either on the surface or in the tissue of the body we can call as infestation. In another term, multiplication and development of an infectious agent on the surface of a body. This is also called as infestation. That means the presence, multiplication and development of an infectious agent on or in the tissue of a body we can call as infestation. Example, roundworm infection. Next is contagious disease. What is contagious disease? The disease which is transmitted from one individual to another by direct contact. Again, the example is COVID. If this COVID-19 patient is in direct contact with another person, then there is a high level possibility of happening the same disease to that person also. So, this infection is that much strong to give or spread the disease to another healthy person. These types of diseases are called contagious disease which is transmitted from one individual to other by direct contact. Then communicable disease. This is a common term which includes both infectious and contagious disease. Infectious disease means the disease resulting from infection, any type of infection. But if you specify there is a contagious disease, it means there is a possibility of spreading this disease from one person to another. This is contagious disease. And both these diseases are coming under communicable disease. Sporadic. What is sporadic? Occasional occurrence of a disease in a few individuals or in a scattered or isolated areas. This is called sporadic disease. That means in irregular intervals some diseases are occur and after that intervals it disappears. But it occurs in a very few individuals who are scattered or isolated in some areas. Okay, these types of diseases are called sporadic disease. Then what is endemic? The disease which are restricted to a particular area in a relatively low level throughout the year. This is the difference. In sporadic disease, there is occasional occurrence, okay, and for a few individuals. But in case of endemic disease, the disease is restricted to a particular area in a relatively low level throughout the year. There is a possibility of acquiring this disease throughout the year in a particular area. For example, just like chicken pox, even though it is happening for a few people, but there is a possibility of happening this disease in a low level risk throughout the year in that particular area. These types of diseases are called endemic disease. Then what is epidemic disease? This is something more dangerous. How? Quick and rapid spreading of a disease on a mass scale is called as epidemic. For example, we can take Ebola virus. Ebola virus. What happened in the case of Ebola virus? It had a tendency to spread very rapidly and in a very short period of time, and it affected a mass scale of population. Where it happened? It is in Africa. Ebola virus spread in Africa and it affected a mass scale of population. The spreading was in a rapid scale. Okay, these types of diseases are called epidemic diseases. Then what is pandemic? It's more dangerous. COVID-19 pandemic. Why? All geographical barriers are overcrossed. In the case of COVID-19, it spread all over the globe. Only Antarctica is not affected. All other continents are affected by COVID-19 pandemic. The disease which spreads from one country to other in a very short time or occurs in different countries at the same time. Both the situation we called as pandemic. Either the disease spreads from one country to other or from one continent to other in a very short time, or it occurs in different countries or different continents at the same time. Okay, both this condition we called it as pandemic. Then exotic. This is term called for those diseases which are introduced from a foreign land. The diseases which are not natively of that particular place, or those diseases which affected to some animals which are carried from their native place to another geographical area. In such cases, there is a possibility of happening of some type of diseases. These are called exotic disease. Disease which is introduced from a foreign land. This is called exotic. Epizootic. What is epizootic? Zoo means related to animals. So the epidemic occurring in animals is called as epizootic. What is epidemic? Epidemic diseases are those diseases which occurs very quickly and spreading very rapidly. Those diseases are called epidemic. And if the epidemic diseases are affected to animals, then it is called as epizootic. Okay. Zoonotic. Zoonotic diseases are those infectious diseases of animals through which it affects human being. This is the difference between epizootic and zoonotic. Epizootics are those diseases which affect to animals only, but zoonotic are those diseases of animals. This is the diseases of animals, but there is a possibility of spreading this disease to human beings from animals. The disease of animals through which it affects human beings are called zoonotic diseases. Nowadays, the attack of the zoonotic diseases are getting increased due to different types of laboratory tests by using these animals, this like rats, pigs, etc. Okay, then what is a carrier? Is this carrier a patient? No, not at all. Carriers are individuals who possess the infectious agent without suffering from the disease but are capable of transmitting the disease to others. Suppose this is a human body, the infectious agent enters to this body and this infectious agent get grew and multiplied. Okay, this developed. This person is that much strong to spread this infectious agent to other person who is with less immunity or any other problem. So if this person is coming under direct contact with this person, the infectious agent may get into transferred into this body. So this person works as an agent. Okay, this is called as carrier. He can give this infection to other person and this person may get diseased. The individuals who possess the infectious agent without suffering from the disease but are capable of transmitting the disease to others are called carriers. Incubation period. This is also important. Suppose this is a human body. Again, I will give you the same example. Infectious agent comes, okay, then it starts develop and grow. Nothing will happen. After some days, this person starts to show some symptoms of disease. That is, the person is affected by infection which is given by this infectious agent. So, the entry of this infectious agent to this person and the expression or starting or onset of symptoms of a disease, the time period between these two incidents is called as incubation period. Latent period between the entry of an infectious agent into the body and the onset of symptoms of a disease. This latent time period is called as incubation period. Then quarantine. I think one of the most used word this year. This is quarantine. What is quarantine? Isolation of an infected individual such that he does not mingle with others till the incubation period of the infecting organism is over. The isolation of an infected individual. Okay, the person is get infected. Now there is a high risk, high possibility of spreading this disease to the community by this person. So the best thing is that to keep or isolate that individual from that society so that the infection cannot be given to other person in the society till the incubation period of that infecting organism is over. Incubation period means the person is already infected. Okay, then if this infectious agent spreads to another person, then again the process starts. It develops within his body and after some days he also starts to show the symptoms. So this is the incubation period. It is varying, depends on the characteristics of the infectious organism. In some cases it is 7 days, some cases it is 14 days. Okay, so till the incubation period of the organism is over, till that period the person, the infected individual can be isolated and this process is called as quarantine. Toxin. What is toxin? If any person is infected with any infectious agent, then there is a possibility of producing harmful substance within the body and there is a possibility of spreading this toxin to other persons from his saliva or any other body fluids. This harmful substance we can call as toxin. And endotoxin, these are the toxic substances produced by a microorganism when it is alive. This is the importance. And the toxic substance affects a distant tissue away from the site where the organism lives and there is a possibility to spread this toxic agent, toxic substances to other parts of the body also. Okay, this is called endotoxin within the body, within the living tissue when the microorganism is alive. Okay, and the toxic substance affects a distant tissue also which is away from the site where the microorganism lives. This is called endotoxin. Next is vectors. What is vectors? It's a very common term. Insects which transmit a disease called vector. It is like mosquitoes, flies, lice, etc. This mosquito, flies, etc. spread many types of diseases. Okay, so this act as a vector. These are capable to transmit a disease. Fomites. The articles which can absorb, retain and transfer an infection is called fomites. These are non-living things. Okay. For example, towel, utensils, pens, pencil, even books, etc., which are used by an infected person, these are also enough to spread the infection. Okay, these articles can absorb the infection. Okay, the wet towel of the patient, the used towel of a patient can absorb the infection, and if the same towel is used by another person, there is a high level possibility of spreading the disease. So these articles are called fomites, which can absorb, retain, and transfer an infection. So these are the important terms and definitions, which is very important to know before we go into the detailed study. So this was for today's class. Hope you enjoy this video. Thank you.